Commissioner Clemente,
Here.
Commissioner Dodd.
Here.
Commissioner Garza,
Here.
Commissioner Hattis.
Here.
Commissioner Killeen.
Here.
Commissioner Kenlock,
Present.
Commissioner Kenizic.
Here.
Commissioner Marecki has requested an excuse. Commissioner Baker McCormick. Here. Commissioner Scott has requested an excuse. Vice Chair Pro Tem Badun.
Here.
Vice Chair Palomero.
Here.
Chair Bell.
Here.
You have a quorum present.
Thank you so much. Next item.
Approval of the minutes from the February 8th, 2023 meeting minute.
So moved. Support.
Moved and supported. Are there any deletions, any corrections, anything to be added to the minutes? Hearing none, all in favor say aye.
Aye.
Any opposed? Ayes have it. Next item.
Chair's remarks.
Nothing.
Unfinished business, there is none listed. We're moving to item E1, communication dated January 4th, requesting commission approval of a sole source professional services contract with a one-year option to renew between the Charter County of Wayne and Medical Debt Resolutions, Inc.
Thank you
Madam-
so much. Thank you so much. At the last time we had committee of the whole, we had a great discussion, but we didn't have our analysis completed from our staff. And there were questions that needed to be asked and answered. And you all should have received our fiscal analysis, our legal analysis, and our policy analysis on this item. And we have a big packet of all of that information, and hopefully everyone has read it. So what we're going to do now is I'll entertain a motion.
Madam Chair, move approval.
Okay, and then we're going to have discussion, a great deal of discussion, or as much discussion as we need to have before we move forward with the vote. So at this time, I'd like to call Dr. El Sayed to refresh what we're doing with this item.
All right, medical debt, take two.
Yeah, take two.
Dr. Abdul El Sayed, Director, Health Officer, Wayne County Department of Health, Human and Veteran Services. So we're here today to discuss an opportunity before our county to wipe away up to $700 million in medical debt for up to 300,000 of our community members. And I want to remind us that when we talk about medical debt, we're talking about a set of choices somebody had to make out of fear of loss of life, loss of function, or immense pain. Now, these aren't choices that people take willingly to go and get healthcare. And I want you to think about the last time you were in pain or you were worried about your body functioning the way it needed to. And for lack of insurance or lack of money, people incur these debts, and then these debts chase them around their lives. And given the nature of our healthcare system, we are currently in a moment where more than 50% of all medical debt incurred in the last year was incurred by people who were duly insured, right? So it's not that they didn't have health insurance. It's that the cost out of pocket of their health insurance was so high that beyond their health insurance, they were forced to take out loans. Since we've spoken last time, I was recently hit by a $697 bill because I was in California over the holiday. I had strep throat. I knew I had strep throat, but could not confirm that I had strep throat without getting a strep test. In order to get a strep test, I had to go to an urgent care. And so I went to the urgent care, and our insurance paid $42 of it. And I was hit by $697. Now, I literally at lunch today got a call from the insurance company when I appealed, and they said, well, you should have looked for an in-network provider.
Wow.
I was like, I was in LA.
Wow.
I mean, do you have in-network providers in LA? They're like, well, you could have called. I was like, so I had a 105-degree fever, and you wanted me to call all the urgent cares in LA to be told that none of them are in your network so that I could go to that urgent care and end up getting hit by the bill anyway, just to have a PA tell me that I had strep throat so I could get some amoxicillin and get care.
Wow.
But you imagine, right? I'm someone who's insured and understands the system relatively well. So you can imagine a circumstance, and the circumstances that so many of our community members find themselves in situations where they incur debts. And I'm fortunate to be able to pay that $697. I don't want to, and I'm going to fight it, but I'm fortunate enough to be able to pay it. So many people can't. So we're in a situation today where we have an opportunity to do a one-time allocation in the way that many of our sister counties across the country already have. They have been able to make this investment and support their folks. And one last point, I know that I am a health director and we're talking about a health intervention here. There's a lot more than health. You think about how many people would be able to afford a better rate on their mortgage or afford a car loan, but for their ruined credit because they had to take on medical debt. So when we think about the kind of intervention that we're talking about here today, yes, it is a healthcare intervention, but it's also an economic intervention. It's also a well-being intervention. And so look forward to the conversation today. I'm happy to discuss any questions folks have, but this really is a momentous opportunity for this body. And I'm just grateful that that you all under your leadership are taking it up.
Thank you so much, Doctor. When one of the commissioners from Oakland County brought this to my attention last year, I thought it was an enormous opportunity to help people in our communities and in our districts that have this, it's a horrible issue, just like you. Thank God you have the means, but so many more of our constituents don't have the means to pay. And this is something that haunts them on a daily basis. So to be able to do something that's out the box, is progressive, yes. And I think that's something that people look for leadership to do, is to kind of think out of the box. And this is a great opportunity for us to do that. And I think it will be in that league of counties across the country who are taking some different steps, but needed steps to help our constituents. I'm sure we're going to have a long list of questions. So questions from commissioners. Commissioner Palomero.
Thank you, Madam Chair, and thank you. I had a great conversation with you earlier today. One question that I forgot to ask, and just trying to understand all of this. So this 5 million goes to the debt resolution company. It doesn't go to satisfy any of the medical debt. It goes to this company and their subcontractors to work out so that 700 million in medical debt is forgiven, if you will. Is that correct?
So what would happen is this is an authorization by the you would authorize up to $5 million to leverage by this company against debts owed to healthcare systems. And then they would negotiate directly with those healthcare systems to forgive those debts for individuals who meet those criteria. And those criteria are they earn less than 400% of the federal poverty line. So for a family of four, it's about $100,000. Or that they have debts that are greater than 5% of their income. And so we're giving money to this organization who then would give it to healthcare systems at a negotiated rate to wipe down that debt.
So part of the 5 million will go to the healthcare systems, hospitals, if you will, to satisfy the debt. I mean, and if you're starting at 700 million and they're only got 5 million that is a deep discount.
So yes, exactly. And let me explain the economics there. The moment a healthcare system fails to collect on a debt, the actual value on the market of that debt is well below the sticker price. So let's say somebody had $1,000 for care. The minute they go to collect and they don't get $1,000, now that debt can sit on a debt market, but the value of that debt is no longer $1,000 because the probability that it ever gets paid is substantially lower than 100%, right? So you basically take the value of the debt multiplied by the probability that it gets paid, let's say 15%, and now you got debt that's worth about $150, right? So this organization then comes along and says, "Dear Henry Ford, you've got a bushel full of bad debt. And rather than waiting for some collective collection agency or selling it to some collection agency who's going to destroy these people's lives, destroy their credit, and probably never get paid, we're going to give you 1 cent on the dollar or 2 cents on the dollar. And you give us the debt, then we write off that debt for those folks. We send them a letter. They're not taxable. It's not taxable debt relief, right? And they get their debts delayed. You don't have to worry about it anymore. You get a check where otherwise you wouldn't have gotten a check. And we're good, right? And that's the way the process works. So it's a deep, deep discount.
Okay. And lastly, and I've heard from constituents in support of this, and I plan to support this myself. Is anybody working with the credit bureaus to make sure that our constituents aren't getting nicked on their credit reports? Is part of this money going to help that too?
So one of the services that RIP Medical renders is to verify that that debt is wiped out with the credit servicers.
Okay. Thank you very much, Doctor.
Yep.
Thank you, Commissioner. Commissioner Clemente?
I was just wondering, do we have a list of the healthcare providers that they're going to be targeting in this debt? Will we know who they're asking
So it's
in
going to
Wayne
be,
County?
So it's going to be some big names, Henry Ford, DMC, et cetera, and some smaller names, some practices, right? And they're going to cast a wide net and engage with as many folks as we can. In fact, we've already done some of the legwork to engage with some of the healthcare systems to bring them to the table on this conversation. And so the hope is that you can't force a healthcare system to engage in this, but you can certainly make it worth their while. I think the economics are playing for themselves, which is why this has been such a popular program to participate in, right? Where it's been passed in other communities, local healthcare systems have taken advantage of this opportunity, right? Because it's an opportunity to get a check where you're probably not going to get one, right? At a very discounted rate for the goal of wiping out debt. So they'll cast a wide net. It'll include the big players, and it'll include some of the small players, and as many of the small players as can. And I'll tell you, for smaller practices, although they're kind of going extinct at this point, but smaller physician-owned practices, the difference between a check and no check is a much bigger deal than it is for a Henry Ford or a DMC. So they tend to be, willing to participate.
Thank you. Commissioner Baidoon?
Thank you, Madam Chair. Thank you again, Dr. Abdul Sayed, for coming today to discuss this. I will definitely fully support this. As I mentioned last time, I know firsthand the negative impact these medical debts have on a potential first-time home buyer, or if they're trying to lease or buy a car. I think you may have answered part of my question when Commissioner Palomero was talking about, so you basically approach these hospitals or health facilities, and you try to make a deal with them before they transfer the debt to the collection agencies?
Ideally, yes. And even when they do engage with the collection agencies, they usually have a callback option on that debt. See what I'm saying? So,
Oh, they do.
and so they can use that callback option and say, all right, we can wipe this down. We got a deal on this, right?
So in most cases, you will not be dealing with collection agencies.
No.
Okay. All right. So but let's say there's a debt that's already with the collection agencies, and the collection agency says you have to deal with us. We cannot send it back to the hospital, for example, to Henry Ford or to Beaumont or Cornwell. What happens in that situation?
So the organization we're working with, we're talking about the vendor, and I wish they could be here. They were here last time, and unfortunately our key contact there had to be on an airplane today. But we can hopefully have him here for the should this pass, hopefully have him here for the full board meeting. But they don't work directly with collections agencies. They work directly with hospitals and
Okay.
healthcare organizations. And so in some respects, you think about the relationship that a healthcare system has with a debt collector, that's between them, right? This organization will work with that hospital and usually engage them on behalf of on that debt. So I can't tell you exactly, in any circumstance, the circumstance that you're raising as a hypothetical is, hypothetically possible. From what I understand from the past experience, it hasn't been a challenge for the healthcare systems to be able to call back that debt and get it paid down where it's eligible.
Okay, from my knowledge, a hospital bill will not be transferred or reported to the credit bureau unless it gets transferred to a collection agency. That's what I know from my real estate experience. The other question that I have, so let's say there's a $5,000 debt with the Henry Ford Hospital, and they negotiate this balance down to $250. Are they going to send this person a 1099 for the difference? Because, a lot of people, when you make settlements with them, they send you a 1099 that you have to claim on your taxes. Is that going to be part of the equation?
So it's not taxable debt. So the debt relief that is paid down is not taxable.
It is not. So they will not send the person a 1099 at the end of the year?
No.
Okay. Thank you. I will fully support this.
Thank you so much, Commissioner. Commissioner Hedges?
Thank you, Madam Chair, but Sam asked. Commissioner Baidoon asked the question I was gonna ask about the people who's already in the collection process and the collection agency charge the healthcare to collect some money. Is that gonna be a problem? Or it's between the healthcare and the collection agency that would not be anything to slow the process of this issue?
I can't speak to speed of process. What I can say is that in previous experiences, we looked into this with them. Large healthcare systems and even smaller ones didn't have an issue being able to leverage their relationships with debt collection agencies to pay this down. What I can do is also just make sure that I get you a little bit more information on that from RIP Medical. I would imagine it probably does slow down the process a little bit, but I also know that the healthcare systems have fully accurate records of all of their patients in arrears who meet the criteria. And part of the subtext of the engagement with RIP Medical is that they're going to be able to wipe away all of that debt. So it's something that they process through. And for the healthcare systems, it's in their incentive to be able to get that check, even if they've handed it over to a collection agency. And then the last thing I'll tell you is that they don't deal with collection agencies. So none of our funding here would go to a collection agency. It goes to local healthcare systems for the most part, and helps to pay down that debt. So in some respects, it's a benefit to certainly the people who are having their debt wiped down, but it's also a benefit to our healthcare companies here in Wayne County, where most people are getting their healthcare. And it is money that they can leverage and reintroduce into their operating pool that they otherwise might not have gotten.
My second question, Madam the Chair, is we put in up to $5 million here to wipe $700 million. Is the question, let's see, we get to appoint the $5 million. It's not enough. Are you going to stop there or are you going to come back for more money? Because I am in support of this program and I'm really strongly feel we need to spend as much as we can to wipe that debt, because those people who can't afford to pay, who doesn't pay the medical bill? It's people who can't afford it, who doesn't have the money. And some people sometimes die home because they can't afford to go to the doctor or the lack of health care. I think, to me, it's the best thing the county doing now for the citizen of Wayne County. I hope we continue till we wipe all the $700 million.
So we have a one-time option for extension for another $2 million that's written in the grant. And should we take advantage of it, that extra $2 million, this is based on an estimate from RIP Medical that is driven by their research on Wayne County as we approach them about doing this, about what they think it would take to be able to wipe down all the debt. And so, we're going for a first $5 million because it's plausible that some organizations would say, thank you, but no thank you. And so we want to make sure that they can leverage that first $5 million. And should they be able to move through that first $5 million, then we would come to this honorable body and talk about potentially another $2 million against that goal.
As we talk about this issue, because there are a lot of people in the need for help in this area. And maybe after this, in the future, we could do something for the people who can't afford to pay copay and base it on the income level. Anybody below certain income level, when they go to the doctor or buy prescription, their copay be paid by the county. I hope we'll see that day. Thank you.
Thank you.
Thank you. I'll ask. Thank you so much, Commissioner. Thank you. A question that Commissioner Coleman just asked, not for clarity, the monies, this is coming $5 million from the ARPA transfer to general fund. No, I'm sorry. Tell us the source of the funds.
Yeah, so it's about 85% coming from indigent funds, and the rest is coming from post-ARPA funds.
Okay.
So the funding that had come from ARPA funds that were used against revenue loss replacement. So technically general funds dollars that descend from ARPA dollars.
Thank you. Yeah, it's a little bit and a little bit to make a whole. And the breakdown is in our paperwork, but the majority of it's coming from the Indigent Defense Fund.
And I want to be clear, that fund it's intended to provide healthcare for indigent folks. And given that we're talking about a cutoff of 400% of federal poverty, everybody who would benefit from this program technically would be indigent, and it would technically be paying for their healthcare, even if it's post facto, right? You know, ideally, you're in a situation where you could pay for healthcare before people ever need it. But in this case, it's people who'd gone into arrears, have to pay debt, and this is an opportunity for us to pay it off.
All right, Commissioner Anderson?
Thank you, Madam Chair. Got a couple of questions. One of them, the percentage that this company is going to, RIP, is going to keep again, versus how much is actually going to replacing the debt or clearing the debt, is how much? What are those percentages?
It's below 10%. Their overheads are quite low. And, you know, this is an organization that has benefited from a tremendous amount of nonprofit funding. And so the way they work is they partner with municipalities for the most part. And then a lot of their overhead funding is subsidized by nonprofit investment. And so they got $50 million from Mackenzie Scott, the ex-wife of Jeff Bezos. And so they're able to operate at such low overheads in part because they're leveraging nonprofit funds against those overheads.
And how are HIPAA issues addressed when they're trying to get information from a hospital, patient information?
Yeah, so all patients are assessed to make sure that they meet criteria, and that's done in a perfectly HIPAA compatible way. And they've had no issues with any HIPAA issues in the past.
Has the state treasurer approved this yet as far as indigent care?
So we don't apply for approval on a case-by-case basis. Instead, we write a letter to the state every year about how we spent indigent money.
Okay. And that doesn't address whether or not a future legislature decides that it's not.
No, I mean, given the
That's
nature.
what happened. As you probably know, the history of what happened with indigent care in Wayne County and the use of indigent care funds from the airport tax, parking tax. And it was actually a bill that was sponsored by a former commissioner years ago. But it did change the percentage that the county was getting because of the way money was used. So that is a concern to me, and I know you can't really address that, what would happen, but it could be a big bill for a future commission and for a future county leadership. If the legislature acted the way they had a history of doing it, and I think it was 2002. But
Fair point. The tough part about the indigent funds and the enforcement mechanism, and it's not the enforcement mechanism that we created, it's the one that's put in front of us by the state, is that if you allow the potential that something might get struck down by the state to stop you from doing a thing, then you do nothing. And you end up working up a gigantic budget that you don't move to do the things that the money was supposed to do. And so, you know, the way that we're trying, this administration is trying to handle that is to make sure that we're working hand in glove with legal to understand what are the appropriate uses and then try and get that money out so that it actually does the thing it's supposed to do, right? And so, you know, we see this based on the analysis of Corporation Counsel as being a perfectly legitimate use of this fund, specifically against the goal for which it was created, which is to provide healthcare support for indigent folks. And so we feel confident in that, but I do want us to just appreciate that, like, over time, if we always say, well, we don't really want to act because there is a risk that, then at some point you end up not acting ever. And money that was supposed to be leveraged for the well-being of our county goes unspent. And in the past, unfortunately, that's kind of what's happened. So we're really trying to work hard to think, how do we make sure we use this in a thoughtful, rigorous, legal way against the ends for which this was intended to be used.
that's all I have right now.
Okay.
Thank you.
I have a list. Commissioner Kleen?
Thank you, Madam Chair. My first question arises from the legal analysis that was provided by counsel. And on the first page, it makes this statement. First of all, Wayne County has an obligation to provide support for medical care of its indigent residents. This obligation is based both on state and county laws. So far, we've talked about the state laws. What are the county laws that are in play here that binds us to support for indigent care.
The Corp Counsel was here, TR is here from Corp Counsel.
Famously not a lawyer, so.
Technically.
Hi, good afternoon, T.R. Winter, lead attorney from Wayne County Corporation Counsel. The county aspect of the historical obligation to support indigent healthcare is in the section of the ordinance that talks about the transitional inpatient and outpatient hospitalization that resulted from the closure of Wayne County General Hospital in the early 1980s. That led to further distinguishment in the Social Welfare Act, as well as the separate statute for the parking tax, as well as the allocation of the cigarette tax money, both of which continue to have an obligation that they be used for quote unquote indigent healthcare purposes. And as Dr. El-Sayed was explaining, you know, that throughout the last decades of the county, the indigent funding has been certified to the state, and proposed uses of it have been evaluated to try to fit within that history of the state obligation to indigent healthcare and how that's evolved in this post-Affordable Care Act Medicaid expansion world, where we look to try to support indigent healthcare in a way where the world has changed since Medicaid was expanded and generally covers a large number of people who were considered indigent by virtue of their not being able to get Medicaid because oftentimes they were single and without children before Medicaid expansion.
Okay, I'm going to try to pull a few weeds here. Going back to the original question, what is the law, charter, responsibilities that Wayne County has, not the state of Michigan? Because I believe the hospital, the inpatient hospital, Wayne County had closed the year before the charter. I believe it closed in 81, the charter, or 80 or 81, the charter came out in 81. And so what instrument gives the county obligation for indigent care?
The obligation for that was structured in the ordinance about the existence of the patient care management system.
Yeah,
set up.
PCMS, the old
That-
PCMS.
Yes,
And then the state followed that up by authorizing in the airport parking tax that we could use that money, or did it obligate the county to use that money?
it obligated it to be spent for quote unquote indigent health care, as well as the
Okay.
tobacco tax money. So it is separate from the PCMS, but it is closely aligned with it in that at that time, indigent healthcare was both the requirement of how that money be spent through the money received from Lansing in the parking tax,
Right.
as well as the separate PCMS program that is identified in the county's charter.
Right, which no longer exists, but anyway. So we need a copy of that ordinance that Wayne County originally did. Because I knew that we did have, and I was under the impression it was charter responsibilities for indigent care. And I believe that's the case. I do want to ask a couple of questions based on Commission Counsel's analysis. Is this relief program limited to Wayne County residents?
Yes.
Okay. Because there were some other, is it limited to individuals that are indigent? And let's just go over that definition. There's a few, right, because the state's got to have a definition of indigent. And if they're mandating us to spend money on indigent care, then it's a good idea if we stay within that guideline. So
It has been an undefined term, as touched upon in our memo.
Yeah.
15 years ago, we sought advice and within the county went to a consulting firm that worked with Lansing on their programs, and it is an undefined term in that statute, but there is a history, as you know, and that is why in this proposal, we have a mix of funding because as you may know, Medicaid expansion allowed for people with a large amount of assets and a low recorded income to qualify for Medicaid. So we did not recommend using 100% indigent funding for this. We did an analysis to say, yes, we understand with Medicaid expansion, there could be someone who is early retired and has liquid assets in the bank, but technically qualifies for Medicaid or a subsidy. That person should not be paid by indigent funds. So we had one of our statisticians run an analysis as to what conceivable percent of people there could be that would be in that situation that would not, in our view, be indigent by Michigan standards and tradition, but under the federal standards, be eligible for Medicaid or a subsidy. So that is why it's not 100% indigent funded.
So that's 90% of folks we're going to deal with will come out of indigent funding.
I think it's 87 or 85%, but yes,
Okay. So that's the
reason.
reason for the mixed funding.
Yes.
Okay. And I'm sure we're going to get reports on that, you know, in terms of indigent families versus non-indigent and
The technically difficult thing about this is because there is no specific definition of, so.
Yeah.
Let me go all the way back to the derivation.
isn't there like a common, I mean, the Fed's got to use a indigent number.
And if we use the Fed's indigent number, then
Yeah.
100% of everybody who applied would be considered indigent. The problem though, is that because this is a state-based allocation question, the question of wealth versus income is not something that's well addressed in state public policy.
Really?
So in theory, you could have millions and millions and millions of dollars,
Yeah.
but your annual income is $200 a year. So you are considered for using that 400% of federal poverty, very, very poor.
Right.
But you have millions and millions and millions in the bank. So what we're trying to do here is say, it is plausible that there are some edge cases that for whom that situation applies, which is why when we thought about our admixture of funds, we did not want to fund 100% of the program on indigent metrics because somebody could come back and say, well, what about these people? They're not practically indigent. They just meet the federal criteria for indigency. So we thought really hard about what mixture of money would protect us from that particular liability. See what I mean?
Mhm.
So if I were to sit down and say, yeah, I could tell you 100% of people will be under 400% of poverty. And if you take that as the federal line, then the report will say 100% every time. But, right, if you entertain my more philosophical approach to asking what does indigency mean, then I cannot tell you how many of those folks actually fit that bill because we don't have wealth information on them. We just have income information.
Yeah, I get it. Do we have any idea of the total debt out there in the county that these funds might apply to?
So the estimate based on RIP Medicals is about $700 million, and which is why we're allocating this pocket of funds.
Right. And with our money, we can pay down 700 million?
That's the hope.
That's the hope. So
That's
now
based on past precedent,
and
based on their
negotiate.
work in other communication.
But we think with this money, we have a real good shot at doing the whole 700.
As I said last time in my tradition, inshallah.
Say again?
Inshallah. We hope and assume so. But
Okay.
you know, there's no, you could imagine one health system saying we're going to hold out.
Of course.
But you know, in other communities, there's also added benefit. And I'll tell you that part of doing this is that obviously all these healthcare systems do business, or almost all of these healthcare systems do business in Wayne County. So they're of interest in maintaining good relationships with you and good relationships with the administration. And so we've been able to leverage those relationships
Not
to
to
say, hey,
mention citizens.
and exactly,
This
right?
is the hospital that won't help you.
Exactly. And so
That kind of thing.
one of the things I hope that will come out of today is that commissioners will tell folks that this is something we're doing. And if they hold medical debt at a particular hospital, they should really think about where they spend their next healthcare dollar, because their hospital should be somebody who participates in the program, right? So that's the other side of it.
All right. Thank you. Thank you, Madam Chair.
Okay.
To the point
that
that
point, Commissioner Anderson?
Commissioner Helene had made, or he'd asked a question about outside Wayne County residents.
Mhm.
Our attorney said that it would not be required or restricted to Wayne County based on a previous testimony in front of us.
Let me explain. So it's plausible
Plausible.
that somebody could be a resident of Wayne County, incur a medical debt, and then move. And if they did that, they would be registered as a resident of Wayne County, right? And we would in theory pay down their debt, but now they're a resident of somewhere else, right? A lesser county. And that is very difficult to defend against. And so in theory, yes, that is possible. Based on the probability that people of this income profile actually move, that's a very low probability outcome.
Just want to make sure everybody realizes. Thanks.
Okay, we have three more speakers, Commissioner Dobb, then after her, Commissioner Baker McCormick, then Commissioner Kenlock. Commissioner Dobb?
Thank you, Madam Chair. In our analysis, our central staff asked about the indigent funds that are being used coming from the airport parking tax. And we requested the reports for the past 5 years. As far as I can see, we did not get those reports. Have those reports become available to us? The reports that are supposed to be filed with the state of Michigan Treasury Department?
You saying the commission hasn't received those reports?
I don't think so. I haven't seen them.
Yeah, so we need to get a copy of those reports that have been filed with the state of Michigan.
Okay.
And we can send that through.
Okay.
Hey, Joe,
Okay.
it's Tony Guerrero
So
from the
someone does
prosecution.
have those
Okay.
reports?
We have
Good.
requested.
I'm just circling back to see if you got a call or not.
Colleen had contacted us Colleen contacted us during the budget hearings, or mentioned to me, and I requested that during the budget hearing. And when you recognize me, I'll also add how we got to the conversation of actually utilizing these dollars from that conversation.
Okay, all right, what did Kamal have something he wanted to add to that? And we don't get.
Kamal Keperu, Management and Budget Finance Director for the Department of Health, Human and Veteran Services. Now, I was just telling Dr. El Said that we did do a search looking for the letters or correspondence that was sent to the state regarding this, and we just hadn't been able to put our hands on it just yet.
The state would have it though, right? The state should have it if we did it.
Correct.
Correct. If we,
If we did it. Okay,
I-
so maybe we didn't do it.
You know, I don't know that would be the most advisable strategy. I just leave that there.
Okay,
Okay.
okay, well,
Because I think we do need to find an accounting for the indigent funds to know the balance, what money has been spent in the past 5 years or so. So that we know how much money we're spending on indigent healthcare before medical debt occurs versus how much money we plan to spend after medical debt occurs.
So we can provide you what sits in indigent funds and where those funds are going every year. And so we actually, yeah.
I got overzealous at the gym yesterday.
Is that a copy for every commissioner? Okay. Take one, pass it down. Can't see this.
So small.
Okay, yeah, I didn't bring my reading glasses. That's fine. Okay, I will review this after. So that
are
I
you
need
passing
the,
out? I'm sorry, excuse me, point of order. If you have something to pass out, please always give it to the clerk and she'll pass it out. And if you can identify what you're passing out, please.
Yes, sir. Yes, what I just passed out is, I was able to develop a report that Commissioner Colleen requested, looking at the indigent health fund over the last 5 years. It's a little small, so I can't email this out. It was hard just getting all 5 years on, quick working sheet. But nevertheless, this is an analysis that showed what came in, and how we spent all those funds. but predominantly most of those funds flows through the Department of our department, and you see that breakdown here. So that's what this document is. But long story short, what I was able to find is that the fund balance as of FY '22 is 24.1 million.
Okay, yep, I see that.
Okay, thank you.
Okay, thank you. I'd still like to see the reports that are supposed to be filed, state of Michigan, if we do have them.
I'm sorry, you done, Commissioner?
I think I'm done. Thank you, Madam Chair.
Okay, thank you for this analysis, Kamal. And hopefully by next week, we'll have the reports or at least a time frame on when we'll get those reports. Commissioner Baker McCormick?
Thank you, Madam Chair. So with this $7 million estimated medical debt from those I guess indigents, or is this a different number from the number you just talked about earlier?
So
7 mil,
this is the total fund balance
okay,
in the indigent fund, from which 87% of the funding toward this project would go. And that funding would be, go ahead.
No, said in another way, that 24 million that I'm estimating that's the fund balance, 6 million will come from that. Because remember, the RRP is based on 1 million from
post-ARPA dollars. yeah.
post-ARPA, and then the other 6 million.
And that's if this is extended.
Correct.
So initially it's 5 million and then, yeah.
okay. So earlier you indicated, I think Commissioner Colleen asked the question, how do we know the debt of residents in Wayne County? And you said estimated $7 million, right?
700 million.
700 million, okay.
And remember, we're not paying down one to one, right? We're paying it down at a steeply discounted rate.
Okay. So, is there, once the company pays off the debt for so many individuals, are we going to get a list of those that they paid off? And is there a way that someone that knows that they have a debt can reach out to the company to try to get on that list? How are we determining?
So the hard part is that as an individual, we're not paying down individual debts. We're paying down debts as they're held by healthcare companies. So it really depends on where that person got care. You see what I mean? And
Right.
so
Mhm.
where they hold their debt, once there's a agreement made with that healthcare system, then they get their debt wiped down. Do you see what I mean? Now, ideally, right, in an ideal world, they'd be able to sit down and say, okay, did my debt get wiped down? But because it's not held centrally, we don't hold that debt. It's very difficult for us to do that. Their debt being wiped down is incumbent on or conditional on RIP being able to reach an agreement with the healthcare system that holds their debt. You see what I
Right.
mean?
And I guess I get that. The problem that I'm having is the check and balances of that and how we know that this is fairly being distributed to residents all over. And we won't know that because it's up to the company and the healthcare system.
And the same time, there's not a situation, I could see where you're coming from, which is to say, I guess what I'm struggling with is what is meant by fair. So it's possible that someone holds debt with, we'll just call them Bad Hospital, okay? And Bad Hospital says, no, we will never enter an agreement. We will collect until the day we die, right? Now, if their debt is held by Bad Hospital, then there's really not much we can do to wipe down their debt. You see what I'm saying? And in that case, that would be unfair to that person. Now, the question, that's one idea of fairness. The other idea of fairness is equitability, which is to say the probability of your having your debt wiped down as a function of who you are in the world, how much money you make, where you live, et cetera. There's not really a reason to think that there's going to be an inequitable distribution, right? Because our goal here is to get every hospital to agree. See what I mean? So you're right that in theory, not everyone will benefit in theory. In other communities in which they've worked, they've been able to get extremely high rates of participation from healthcare systems because it's in their economic best interest. See what I mean? So if the question you're asking is, could it be a situation where lower income people or people of color are less likely to be benefited? On net, that's highly unlikely because it's not all that different based on the hospitals that people use. Do you see what I'm saying?
Mhm.
Now, you know, the one, just to entertain the question here, you could imagine different economics for-profit hospitals and nonprofit hospitals. But I'll be honest with you, the for-profit hospitals have a higher incentive to actually participate because they don't get to write off their debt the same way that nonprofits do.
Okay, and so have we had any, I don't know how you would have a health system agree in advance to be a part, or have you
We've
talked
gotten,
to any?
we've talked to
see-
several,
Okay.
and all of them are excited. All of them are in conversation. All the biggest healthcare systems in Wayne County,
Okay,
right, are actually in conversation with RIP Medical as we speak.
great.
And we've already initiated those conversations. We've already done a warm handoff.
Okay.
And, you know, we've gotten verbal confirmations from several of them that they want to participate.
Okay, so of course, I guess you've already talked to DMCs,
Yes.
INI Grace, and,
Yeah.
okay, great. Thank you.
Yeah.
Okay, thank you. Commissioner Kinlock.
Thank you, Madam Chair. Definitely want to thank you for presenting this to us. As I had mentioned that when we first heard about this, or when it was brought to us, it was during the budget hearings, which was a very extensive conversation regarding the various programs that you talked about to address the issue of poverty and to address the disadvantages of so many of our residents are experiencing, and particularly with you talk about this healthcare debt. Now, from that conversation, we it was brought up by Commissioner Killeen, the idea of you know, he started asking, where's this indigent healthcare fund dollars going? And then we began to talk about this particular program, and our staff and you and I had conversations about utilizing that fund to cover this this program. Initially, it was thought what it was thought, but
Bless you.
initially it was it was thought they had a different opinion, and now we're here, and which I'm glad that you shared the opinion of our fiscal staff that came from our fiscal staff. So what I'm asking you is that why can't we use 100% of the indigent dollars instead of using the general fund dollars? That's my question.
Yeah, so 2 points there. The broader question about the use of indigent funds, I think came up with respect to all of the programs on net.
Correct.
And based on the, you know, what we've shared and discussed today, a lot of the programs that we want to build out wouldn't meet the criteria, the very tight criteria around the use of indigent funds, as Commissioner Anderson pointed to, which is to say, a lot of what has kept us in the past from using indigent funds is the fact that we don't want to get dinged, right, for misuse, for saying, oh, this doesn't apply here, it doesn't apply there. And so for some of our programs, right, that we're thinking about, you think about Narcan vending machines, for example, a program that this honorable body approved. That would not be a program that could be fully funded by indigent dollars.
You know, but I'm talking specifically about
this one.
This one here.
I'll get there.
Strictly this
I'll get
one.
there.
Yeah.
So that was the one piece. But when it comes to this program, it's that problem about the slippage in terms of the definition of indigency. So if you use the federal definition of indigency, everybody who takes advantage of this program will be indigent. And that's the 400% of poverty, all right? The problem is that this is a state enforced program, and the state has not established a very clear definition of indigency. And for that reason, you could end up in the situation where that differentiation between wealth and income ends up flummoxing the ability to say this person is definitively indigent. See what I'm saying? It's that situation where you got a multimillionaire who makes $200 a year, right? And if that happened, you could be in a situation where the state then says, well, this person, Mr. Smith, who's clearly a multimillionaire, took advantage of this program. Clearly, you're not using it to support indigent folks. So what we're trying to do is protect ourselves against that liability by saying, okay, We presume that at minimum, 87% of people who take advantage of this are going to meet every criteria for indigency, the federal one, 400% poverty, and any practical one. And just to make sure that we're not in a situation where somebody could hit us back and then we end up with a big check like Commissioner Anderson talked about, we're going to say 13%, we're going to hold over for any overhead costs. And Mr. Smith, who, by the way, got care at Bad Hospital just while we're doing this, right? That we want to protect ourselves from. That's why.
Okay, let me ask you this, because you just said a couple of times that the state hasn't clearly defined indigent, what indigent is as far as what the thresholds are. So with that, you should have a lot of broad ability to establish that as a policy towards utilizing these dollars for this program. So you can, if the state say you can't, then you can. And what I'm saying is, since you're already doing it anyway, you're defining it as such, why can't you specifically, as you're utilizing and implementing this program, actually utilize these funds for the purpose that you're saying under the guidelines that you establish in anyway?
Yeah, you think I can, and I think I can. The problem is that most lawyers don't think I can. And
Okay,
at some point I learned pretty quick, you got to just listen when they say no.
so then why are we doing this then?
So my point is that we can do it. We're just
Okay.
saying that instead of spending 100% on indigent and
Okay.
opening ourselves up to the liability, part of the problem is this. If the enforcement mechanism was such that you applied, you asked the state, can I use this? And they said yes, then I would be fully okay to do that. The problem though, is that that's not how it works. How it works is you do the thing based on the best estimate of what you think, and then you tell them what you did. And if they come back and say, no, you did wrong, then you're in trouble.
Listen, look, I support this. I'm glad we're doing this.
Yeah.
So whatever's the best route that the wiser minds think, let's go and do it.
I
Okay.
agree with you on that one.
Okay, thank you.
Thank you.
Thank you, Commissioner. Commissioner Clark Holman.
Our general counsel, our general auditor general.
Auditor General.
Possibly, yes.
Yes, we put some language in the contract to make sure, similar with the first audit of the nursing provider at the jail when it was audited, that if necessary, some kind of arrangements with a HIPAA agreement would be made to allow for a HIPAA compliant audit by the Auditor General or somewhere else, because the way the contract is constructed in the regular course of business, we are not going to know the individually identifiable information of the people subject to this, but we recognized from the history of I think the first attorney for that limited purpose with the Auditor General's audit of the nursing provider a few years ago.
So, yes.
Yes. Yes, we thought about that possibility and
And
worked
that-
to have it fit
So
in with
Auditor
this
General
contract.
can audit.
Yes, there's the usual audit language, and we would work to make it happen under HIPAA, just explaining that it would have to go through HIPAA clearance that like we did with the
Gotcha.
nursing one.
Marcy, you're good. Okay, very good. Good with that. Thank you. Thank you. Commissioner Kinlock. I'm sorry. Were you done, Commissioner Clark Holman? Were y'all set? Okay. Commissioner Kinlock.
One quick question. If it comes that 100% of the people are true indigent, will we replace the general fund dollars with additional indigent funding?
Can we do that?
We looked into that possibility in discussing our analyses of how to fund this, and that according to the vendor, there are technical limitations that did not allow, we looked into the possibility of trying to clarify and shrink down the non-indigent potential, and they said they couldn't do that within their system.
Yeah, thank you.
Okay, that concludes everyone who requested to speak. There is a motion on the floor, and maker of the motion, sir, would you like to do 1 and 2?
Yes, Madam Chair.
Okay, let's read number 2 into the record. They're together, they're combined. Read item number 2, which is on the addenda, Madam Clerk.
Item number 2 is forwarded from the Committee on Ways and Means meeting held February 27th. approval of a proposed amendment to the 23-24 appropriations ordinance in accordance with budget adjustment number 2024-35041, certifying revenue in the amount of 1.5 million in the county health fund.
Okay, and again, these two are connected because this is a budget adjustment to assist in this program. Any additional discussion, questions?
So it's moved by Commissioner Kim, both are moved by.
Yes, both are moved by Commissioner Kim, and supported by Commissioner Haydos.
Okay.
Last round of questions, discussion. Hearing none, all in favor say aye.
Aye.
Any opposed? Okay, opposed, Commissioner Anderson. Anyone wish to abstain? Okay, this is, I'm sorry. go ahead.
Motion carries.
Okay, thank you. This will go to full board on March 7th. And hopefully at that time, the principals with the company will be there to answer any questions that you may have for the company directly.
Thank you so
Hopefully they'll
much.
be able either on Zoom or in person at that time. Okay, thank you so much. Next item.
Such other matters as may be properly
Are
submitted.
there any other matters come before the committee of the whole today? Hearing none.
Public comments.
We're not through yet, folks. Public comments. Anyone on the Zoom for public comments? Anyone on Zoom for public comments?
There are no hands on Zoom, Chair.
Anyone on the telephone for public comments? Any emails?
No emails were received.
Anyone in the audience for public comments? One more time, public comments on any means. Hearing none, next item.
Adjournment.
So moved. Okay, thank you all so much.